Good morning, ladies and gentlemen. I'm Lai Yaxin from the Department of Endocrinology and Metabolism, the first affiliated hospital of China Medical University. Today, we are going to learn diagnosis and treatment of Cushing syndrome. First, let's come to the diagnosis of Cushing syndrome. You can see from this PPT, this is the normal pattern of ACTH and cortisol secretion. You can see ACTH level is high at 8 o'clock and it decreased in the afternoon, and in the midnight, it is the lowest point. So the ACTH and cortisol secretion has pulsatile secretion, and it has circadian rhythm. So either amount or rhythm, it can be abnormal in the amount and rhythm. In order to diagnose Cushing syndrome, it is necessary for us to test 24-hour urinary free cortisol and plasma cortisol. You can see for the plasma cortisol, the level is the highest at 6 to 8 o'clock, and it is lowest at midnight. And if midnight cortisol level is below 50 mmol per liter, we can exclude Cushing syndrome. And for plasma ACTH, if the midnight ACTH level is over 2012, we may suppose this patient may suffer from ACTH-dependent Cushing syndrome. And if ACTH level is over 200, we may suppose this patient may be suffer from ectopic ACTH syndrome. And in order to diagnose this patient is suffering from Cushing syndrome, it is necessary for us to do low-dose dexamethasone suppression test. We have two methods. For example, 1 milligram dexamethasone at midnight, and method 2, 0.5 milligram dexamethasone Q6 hour for 2 days. And if the plasma cortisol can be suppressed, it is normal. And if plasma cortisol cannot be suppressed, we may diagnose this patient is suffering from Cushing syndrome, and the cutoff value is 138. And from our guideline, the cutoff value is 50. After diagnosis of Cushing syndrome, it is necessary for us to do high-dose dexamethasone suppression test. Also, we have two methods, 8 milligram dexamethasone at midnight, or 2 milligram dexamethasone Q6 hour for 2 days. And if plasma cortisol or 24-hour urinary free cortisol can be reduced over 50%, maybe this patient is suffering from Cushing's disease. And if after high-dose dexamethasone suppression test, plasma cortisol or 24-hour urinary free cortisol cannot be reduced by 50%, the lesion is on the adrenal gland, or it is ectopic ACTH syndrome. For the diagnosis, it is necessary for us to do ultrasonography, computed tomography, MRI, or bilateral inferior petrosal sinus sampling for ACTH test. And this is the normal pituitary. You can see from MRI, this is the pituitary. And you can see this is the pituitary tumor. It can cause Cushing's disease. And you can see this is the normal adrenal gland, the left adrenal gland and the right adrenal gland. You can see this is a patient suffering from Cushing's disease, and the bilateral adrenal glands has hyperplasia. This is the adenoma of the adrenal gland. What about this one? It is malignant tumor of the adrenal gland, adrenal carcinoma. And what about the liver? Metastasis of the carcinoma. This is the bilateral micronodular hyperplasia. What about this one? You can see from the left adrenal gland, it is bilateral micronodular hyperplasia. For the differential diagnosis, we should think whether this patient is suffering from simple obesity, pseudo-Cushing syndrome, for example, excessive drinking or depression, or small exogenous glucocorticoid. We should differentiate this disease from Cushing syndrome. And this chart will help you to diagnose Cushing syndrome. For example, clinical manifestations, symptoms, and signs. If you suspect this patient is suffering from Cushing syndrome, we should measure plasma cortisol level and rhythm, 24-hour urinary free cortisol. If it is normal, we can exclude Cushing syndrome. If the plasma cortisol level or 24-hour urinary free cortisol level is increased or abnormal rhythm, we should do low-dose dexamethasone suppression test. If it can be suppressed, it may be simple obesity. If not suppressed, we can diagnose this patient is suffering from Cushing syndrome. And then we will measure ACTH level and rhythm. If ACTH level is increased, which means this patient is suffering from ACTH-dependent Cushing syndrome, then we can do high-dose dexamethasone suppression test. If it can be suppressed, it may be Cushing's disease, and if it cannot be suppressed, it may be ectopic ACTH syndrome. And if the ACTH level is decreased, we can diagnose this patient is suffering from ACTH-independent Cushing syndrome. And according to the history, if he has application of glucocorticoid, it can be diagnosed iatrogenic Cushing syndrome. And if no history of glucocorticoid, we can diagnose this patient is suffering from adrenal tumor or hyperplasia. And then we can do adrenal CT, pituitary MRI, and other imaging to diagnose whether this patient is suffering from ectopic ACTH syndrome, Cushing's disease, or adrenal tumor, adrenal adenoma, adrenal carcinoma, and bilateral adrenal hyperplasia. And then let's come to the treatment. For Cushing's disease, the best treatment is transsphenoidal microadenoma. And for some tumor, if it is very large, we can do craniotomy, pituitary radiation, and bilateral total adrenalectomy. And sometimes we can use drugs for those patients who cannot receive operation. And for adrenal adenoma and carcinoma, also surgical removal is the first choice, and we can use drugs for non-resectable or metastatic carcinoma. For bilateral micronodular hyperplasia, we can use bilateral total adrenalectomy. And for ectopic ACTH syndrome, we can use surgical removal of the ectopic tumor, and sometimes if we cannot cut the tumor, we can do bilateral total adrenalectomy. And chemotherapy and radiotherapy sometimes can also be used, and we can use some drugs for them. And let's see what drugs can be used. All these drugs can be used for treatment of Cushing syndrome for those patients who cannot do operation. For example, if the tumor cannot be cut off. All these drugs will act on the hypothalamus, pituitary, and adrenal cortex. Sometimes it may inhibit CRT releasing, sometimes inhibit ACTH synthesis, etc. And Mitutin, we should remember it. It is the most common drug used for treatment in Cushing syndrome. And that's all for this lesson. Thank you for listening.